Understanding yeast infections requires a deep dive into the intricate balance of the vaginal microbiome and the factors that can disrupt it. A yeast infection, medically termed vulvovaginal candidiasis, occurs when there is an overgrowth of Candida fungi, most commonly Candida albicans. Normally, the vagina is home to a delicate ecosystem of bacteria and yeast, maintained by the acidic environment created by Lactobacillus bacteria. These beneficial bacteria keep the growth of yeast in check, ensuring the ecosystem functions smoothly without discomfort or disruption. However, when this balance is disturbed, Candida can multiply rapidly, leading to the development of an infection. One of the primary causes of yeast infections is the use of antibiotics. While antibiotics are essential for treating bacterial infections, they do not discriminate between harmful and beneficial bacteria. By reducing the population of Lactobacillus *, antibiotics create an opportunity for Candida to flourish. Similarly, hormonal changes can play a significant role in disrupting the vaginal environment. Pregnancy, the use of hormonal contraceptives, or even natural hormonal fluctuations during the menstrual cycle can alter the pH of the vagina, making it more conducive to yeast overgrowth. The increased levels of estrogen during pregnancy, for instance, promote higher glycogen levels in vaginal tissues, providing a food source for yeast and encouraging its growth. Diabetes, particularly when poorly managed, is another significant contributor to yeast infections. High blood sugar levels can create an environment that is favorable for Candida *, as the yeast thrives on sugar. Women with uncontrolled diabetes often experience recurrent yeast infections due to this metabolic imbalance. Additionally, a weakened immune system, whether from conditions like HIV, autoimmune diseases, or the use of immunosuppressive medications, can leave the body less equipped to regulate Candida growth, leading to frequent or persistent infections. Lifestyle factors also play a critical role. Wearing tight, non-breathable clothing such as synthetic underwear or tight leggings can trap moisture and heat in the vaginal area, creating an ideal environment for yeast to thrive. Similarly, habits such as douching or using scented feminine hygiene products can disrupt the natural pH of the vagina and irritate the delicate tissues, making them more susceptible to infection. Sexual activity, while not a direct cause, can sometimes introduce additional moisture or changes to the vaginal environment that promote yeast overgrowth, especially if certain lubricants or spermicides are used. Dietary choices can also influence the likelihood of developing a yeast infection. A diet high in refined sugars and carbohydrates can contribute to higher blood sugar levels, indirectly supporting yeast growth. Furthermore, stress, both physical and emotional, can weaken the immune system, reducing the body's ability to maintain a balanced vaginal microbiome. The role of stress hormones, such as cortisol, in altering the immune response adds another layer of complexity to how yeast infections can occur. It's important to understand that Candida albicans is not the only species responsible for yeast infections. While it is the most common culprit, other species like Candida glabrata and Candida tropicalis can also cause infections, particularly in cases where the immune system is compromised or in women who have recurrent infections that are resistant to standard treatments. These non-albicans species often require different treatment approaches, highlighting the importance of accurate diagnosis. Understanding yeast infections goes beyond recognizing the symptoms of itching, burning, and abnormal discharge. It involves acknowledging the dynamic interplay of the vaginal microbiome, hormonal fluctuations, immune health, and external factors. Addressing the causes of yeast infections requires a holistic approach that considers both medical and lifestyle factors. By maintaining a healthy lifestyle, managing underlying conditions like diabetes, and avoiding practices that disrupt the vaginal environment, it is possible to reduce the risk of yeast infections and maintain overall vaginal health. When it comes to treating yeast infections, the first step is recognizing the importance of an accurate diagnosis, especially since some symptoms of yeast infections, such as itching, burning, and abnormal discharge, can overlap with other vaginal conditions like bacterial vaginosis or sexually transmitted infections. It's essential to consult with a healthcare professional to confirm that a yeast infection is indeed the cause of the symptoms and to rule out any other underlying conditions that may require different treatment approaches. Once confirmed, remedies for yeast infections range from over-the-counter treatments to prescription medications, lifestyle modifications, and home remedies. The most commonly used remedies for yeast infections are antifungal medications, which are available in various forms, including creams, ointments, suppositories, and oral tablets. Over-the-counter antifungal medications, such as those containing clotrimazole, miconazole, or teoconazole, can effectively treat many cases of yeast infections. These medications work by targeting the Candida fungus, inhibiting its growth, and ultimately clearing the infection. For women with recurrent or severe infections, oral antifungal treatments like fluconazole may be prescribed by a healthcare provider. These medications are typically taken as a single dose, but depending on the severity of the infection, a longer course of treatment may be necessary. In some cases, women may experience persistent or recurrent yeast infections, meaning that the infection keeps coming back even after treatment. This can occur when the yeast infection is caused by a strain of Candida that is resistant to the usual antifungal treatments, or when underlying factors such as diabetes, antibiotic use, or immune system issues are not addressed. For these types of infections, a more prolonged antifungal treatment may be required. A healthcare professional may recommend taking oral antifungals for several days or even weeks, and may also suggest a more comprehensive treatment plan to address any contributing factors, such as managing blood sugar levels in diabetics or reducing the use of antibiotics where possible. Lifestyle modifications play a significant role in preventing recurrent yeast infections and in complementing medical treatment. Maintaining proper hygiene is essential, but it's important to avoid harsh soaps, douches, or scented feminine products that can irritate the vaginal area and disrupt the natural balance of bacteria and yeast. Using mild, unscented soap and water to cleanse the area is often sufficient. Additionally, wearing breathable cotton underwear and loose-fitting clothing can help prevent excess moisture buildup, which creates an environment conducive to yeast growth. Changing out of wet clothes promptly after swimming or exercise is also recommended to reduce the risk of developing an infection. For women experiencing yeast infections frequently, addressing any underlying health conditions, such as uncontrolled diabetes, is crucial. Proper management of diabetes, with an emphasis on keeping blood sugar levels stable, can significantly reduce the risk of yeast infections. In some cases, adjusting medication or dietary habits to support better blood sugar control can help prevent future episodes. For women with weakened immune systems, due to conditions like HIV or the use of immunosuppressive medications, it's important to work closely with a healthcare provider to ensure proper treatment and prevention strategies are in place. Home remedies for yeast infections, while not always scientifically proven to be effective, are commonly used by many women to alleviate symptoms or as a complementary treatment to medical options. Some women find relief with natural remedies such as probiotics, which contain beneficial bacteria that can help restore the natural balance of the vaginal microbiome. Probiotic supplements or yogurt containing Lactobacillus strains may be helpful in supporting the health of the vaginal flora. Other home remedies that are often cited include the use of coconut oil, which has antifungal properties, or apple cider vinegar, which may help restore the vaginal pH balance. However, it is important to note that while these remedies may provide some symptom relief, they should not replace conventional medical treatments, especially for recurrent or severe infections. In addition to these treatments, it's important to maintain a balanced diet to support the immune system. A healthy diet rich in vegetables, fruits, and lean proteins can help the body fight off infections. Reducing sugar intake, especially refined sugars, is particularly beneficial, as high sugar levels can promote the growth of Candida. Staying hydrated, managing stress levels, and avoiding excessive use of antibiotics can also contribute to overall vaginal health and reduce the risk of future yeast infections. While remedies for yeast infections are effective in treating the condition, prevention is key. Maintaining a healthy lifestyle, avoiding behaviors that promote yeast overgrowth, and following proper hygiene practices are essential in preventing recurrent infections. Women who experience persistent or frequent yeast infections should consult with a healthcare professional to discuss long-term strategies for managing and preventing the condition. This may include prescription medications, lifestyle changes, or adjustments to any underlying health conditions that may be contributing to the issue.